We're spreading heart health awareness throughout the month of February. Now, did you know cardiovascular disease is the leading cause of death for women in the United States? Recent research shows a link between menopause as well as heart issues. Now, here to break down that data is Dr. Patricia Egwuatu with Kaiser Permanente, Capitol Hill Medical Center. Thank you so much for taking the time to talk about this very serious issue with us this morning.
No problem. Happy to be here.
Now, I want to kind of start off with, can you give us a brief intro to how menopause relates to something like heart health?
Yes, I think this is a great question, and taking a step and just fixating on it is that women are understanding that heart disease is the leading killer, right? And also that women are being diagnosed later than men. And the connection is around perimenopause and menopause. We're seeing an increased diagnosis around heart disease. And in 2020, the American Heart Association actually published about this connection.
So let's dig into that. What actually happens to women during menopause that increases that risk for heart disease?
Yeah, so many things are happening, which is kind of crazy to think about. The estrogen levels are starting to fall, and that's changing some of the aspects of the body. So we know that cholesterol levels are shifting, so the HDL, which is the good cholesterol, starts to go down. The bad cholesterol, LDL, goes up. And also the arteries are starting to stiffen and harden, so that's increasing that cardiovascular disease. And then additionally, there's more weight that is around the abdominal area, leading to glucose increase in type 2 diabetes.
Right. And when you hear this stuff, it can be scary. You're sitting there watching, like, oh my gosh. The question I would have, and I'm sure so many people, is what can you do? What can women do in these situations to respond to this increased risk?
I agree. It's super, super scary, right? But having conversation with a physician or provider, understanding what your risks are, so knowing about your blood pressure, your labs like cholesterol levels, if you can get more sleep in your life, about 7 to 9 hours, if you smoke or drink, decreasing that, being physical and getting more nutritional values is really important.
Now, a big question is, would a person be able to know if they're developing a heart issue during menopause? Is that something they can become aware of?
So heart disease, unfortunately, is a really silent killer. Not everyone's going to know when they're developing it. But if you can know things about yourself and your risk and hey, what is my blood pressure? What are my cholesterol levels? Having that conversation, that can actually help.
Now, I think, again, we talked about this a little bit, but what can you do? So what can you do to make that you are as healthy as possible with these situations that seem like, I mean, obviously, are going to happen in some capacity?
Yeah, I think this is a great question, and this can all start before your perimenopause or menopause, right? So if we can really just focus on being healthy, just being healthy, focus on physical activity, nutritional, what are you putting into your body, decreasing alcohol, decreasing smoking, having conversations about this, we can really mitigate those risks to developing heart disease.
I think what's so scary is menopause is something that happens to every woman.
Yeah.
And it's on the horizon, it's on the future. Can you talk to me about that, about understanding what's to come and how you can accept that that's a part of life?
Yes.
And as well as be ready for it, as well as with this connection that makes it even a little bit more scary to hear.
So we know that the average age for menopause is around 51 and a half. Right. So if women know that and they're starting to know some symptoms, so sometimes women will be like, hey, I'm experiencing hot flashes, I'm having more brain fog, or I'm more tired. Those are actually some things that could be leading to menopause. So having that conversation with a physician or even loved ones, I think just chatting about it, we talk about a lot more, we get the symptoms out there, people can understand their risk and what they can do, we can really help to shift the conversation.
One last question I want to ask you is, can you talk to our viewers about the fact that menopause happens? Is heart disease also connected, like it's going to happen as well?
You know, we hope it doesn't, but there is a connection. So knowing that there's a connection and it could happen is really doing what you can for your body. So being physical, eating healthy foods, getting sleep, just really owning on in just this healthy lifestyle, you can help to decrease that risk.
Thank you so much for sharing this such important information, things that you might not know. I appreciate you taking the time to talk to us.
No problem. Happy to be here.
Thank you. Thank you.